Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning.
Good morning, Dr. Mencia. We're going to have a whole hour today. So
yeah.
We're going to talk about
Bring it on.
Yeah, we're going to talk about some very important issues. And when Dr. Mencia came in today, we thought that we would talk about something that seems to be a very common occurrence, and yet, and Dr. Mencia's book, Take Care of Your Kidneys and They Will Take Care of You, is very popular, but I don't think we talk enough about this whole situation. So, as a physician.
No, you know something? That book, Anita, need to be explored a lot more. Not because it's going to make us money. In reality, it's because there's such a huge need for awareness of what the kidneys are supposed to do. And I guess the main reason that motivated me to write the kidney is as I went from normal kidney function all the way to the end stage kidney disease, which is when the patient ends up in dialysis. Just before the end stage kidney disease, hundreds of thousands of people are dying of kidney damage, and they don't die when they have end stage. Those are the lucky ones. The few that end up in dialysis, the few 100,000 that are out there in dialysis, those are the lucky ones. Because most people with kidney damage, they die before that stage. And that's what motivated me. I said, I have to bring awareness.
Well, I know so little, actually, because I don't usually have these problems. I think the bladder, I started talking about the bladder, and I don't even know. I really was happy for Dr. Mencia to draw me a picture of where the kidneys are and what happens to the bladder. And it's kind of complicated. And I told Dr. Mencia that every once in a while I get
But we make it easy.
Right. I know you always do. The bladder infection, I've had that in the past. I don't have that now. And let me just say this. As a woman, I go to extreme care. I have tucks. I wipe myself very clean because a lot of that seems to
contribute.
Because the way you explain the difference, and maybe you ought to share that with your audience,
Right.
the way it looks for a man and for a woman.
Well, like right below your rib cage, but on your back, on the back of your abdomen, we have the kidneys. And the kidneys, that's the factory. That's the where things are produced. So the kidney take all the waste material and cleanse it from the blood. And those factories will send it down the highway, which is the urethra. But then the urethra can only take so much. And your kidneys are working when you are awake, when you are sleeping, when you are running, when you are doing anything. Your kidneys are there working, producing. So that factory never shuts down. The urethra will then bring that down and drop it into the bladder. The bladder is the storage unit. So that's where we store, that's the reservoir where all the urine that had been produced get put in until the person find a place to go and empty their bladder. But the kidney, the factory is constantly working. So if a person develop what we call a urinary tract infection, usually is down below by the bladder. And like you say, a woman that doesn't change their underwear frequently, doesn't wipe herself properly, get an infection in the vagina or the skin. A lot of time we see, especially on diabetic patients, right in the inguinal area, which is on both four and the lower part of your abdomen, they get this rash. And that rash comes right into the vagina sometimes. And that rash is based on a fungal infection. And because the urethra is so close to the surface in a woman that it makes them prone to bladder infection much more than a man. Because, from kidney to bladder, to the end of the bladder where the urine is going to come out, men and women, we are both the same. The difference comes that in a man, after that point, then comes the prostate, and they take a few centimeters. And then come the penis, and they take another few centimeters. And the distance now between the outside and the inside, the bladder, in a man become a bit longer than in a female. And that's why women are more prone. Now, we have to teach the female from a very young age how to wipe themselves. For example, when you wipe your butt, you don't wipe forward because you're going to bring the infection from the feces into the vagina and into the bladder. And that's how young girls get urinary tract infection, usually by very poor hygiene.
Let's talk about older women, not just because you say young girls.
Older women are more likely to get, because remember, as we age, the skin tend to thin out. We have less protection. The skin is the largest organ in the body. If you look at the skin, and the skin is an organ, just like your heart and your lungs and your kidneys, the skin is the largest organ in the body. And as we age and we don't take proper care of the skin tends to start thinning out. So in a young girl that wipe herself the wrong way or get a little vaginal overgrowth bacteria, the skin is so thick that it can close the entrance to the bladder and they might not get an infection. In an older woman, the skin is very thin, which allow more room for that sphincter that closes. Sphincter is like that window that protect the bladder from anything from the outside to come inside. So in an older woman, they are much more prone.
And also, just I can add something, please, is that many are incontinent. And so now you have the urine sitting there, then they're wearing pads.
Right.
And now that's
that
added.
Pad
so
get infected it become a source of and remember that we have what we call the normal flora. The normal flora are the bacteria and fungus and organism that lives in our body. And in a woman, the normal flora in the vagina is what helps maintain the pH of the vagina. But let's say they give you a very strong antibiotic for a sinus infection or an ear infection, a young woman or an elderly woman. You give a strong antibiotic. The antibiotic doesn't know any difference between the bacteria that is trying to kill in the sinuses versus the bacteria that are happy-go-lightly in the vagina. So you're going to alter the balance, the natural balance the vagina wants to have. You alter that. By altering that, then you alter the pH. By altering the pH, now you allow bad bacteria that were there, suppressed, now they grow and overgrow. And now you have another infection that that is a consequence of the use of antibiotic.
So what if a woman is on antibiotic for something else, should she have yogurt? What should she?
Absolutely, yes, because the yogurt help with maintain the flora. And if a woman say, every time they give me an antibiotic, I always get a yeast infection in my vagina. So then in that case, there's a medication that you can take either one time when you start the antibiotic, or the way I like to prescribe it is 3 small doses so that they take in alternating days. So if you're taking antibiotic for 7 days, we're going to do 6 days of the antifungus medication so that we keep the balance between the vagina and whatever we are trying to treat.
But let's go then to the male. So let's say you as a man have had antibiotics. Is it going to affect, you don't have anything there?
No.
There's no flora.
We
down.
don't have
There's
no
nothing.
flora. And
There's
we don't,
nothing there. So
there's nothing.
But there are men who do have infection. They do have UTI.
Men can get UTI,
so how's that?
especially elderly men are
Why?
more prone. Well, now the prostate is no longer creating that barrier that we had there before. The penis now is very flaccid, very thin, which allowed the lumen to open wider. So that makes bacteria to be able to travel upstream and infect the men.
Okay, I got to stop for a second. And, we go on because we're having so much information. But this is Dr. Andy Mencia. Andy Mencia is becoming very famous in South Florida and elsewhere because he loves to educate people. That's why we're so blessed to have him on the radio every week. I
love coming to this show.
Yeah, but you do. You educate, and you do this for a lot of other organizations. He teaches so much, but it is amazing how you see everything in pictures. You actually see them in pictures, and you're able to articulate them. But this is a very important issue, especially for women, and I'm glad you're handling this because if people just know more, they can help themselves. But if they do get in trouble, do not delay. Right?
Absolutely.
And we were talking about that.
Because when you go to your doctor, I wrote the book on the kidneys, so I have more knowledge with regard to the topic than a person that just, have become a family practitioner or an internist. So writing the book empowered me to educate, other doctors and the population out there on the function of the kidneys. And the kidneys, when we go to a doctor, usually what we do that dipstick to check the urine, to see how's the pH in the urine, to see if you have bacteria or not, to see if you have sugar in the urine or not. We call glucose.
Or protein.
Or protein. See if you have protein.
This morning.
Now, sugar, if we see a lot of sugar being spilled into the kidney, usually we say that you're taking a medication that is making you do that, or you are a diabetic. So we want to look into diabetes, in that person, especially if they have a strong family history of diabetes. When we look at protein, it's a different ball game now. Protein, by the time, the small protein is called albumin, and urea is urine, and micro means small. So microalbuminuria, you cannot see with the dipstick. It cannot be detected. It's a special test that you don't have to go to the lab for a special test to see if you have small protein in the urine, microalbuminuria. And if you do have a small protein in the urine, and we are able to detect that early in the game, we can reverse any damage to your kidney and prevent you from going from stage 1 to stage 2 in a very fast decline.
Is this
so we can slow that down.
Is this done always with antibiotics?
With the damage to the kidney can be done with many things. Antibiotic, blood pressure medication, diabetes, hypertension. So there are many things. Water pill, a person taking excess amount of water pill unnecessarily. Some people want to take water pill to lose weight. So the kidney is a filter, right? It's trying to filter and cleanse the urine. So like your lungs, when you exhale, when you let the air out of your lung is filtering gases. So when you exhale, the gases that the factory have produced throughout your body, through the different metabolism that we undergo around the clock, every time you exhale, those gases come out. And when you inhale, when you take air in, you bring more oxygen to continue that cycle. The kidneys are working the same way. When the blood goes through the kidney, they got to be filtered, to be cleansed. So the kidney will have the functional unit of the kidneys are the glomeruli. And we have thousands, millions of glomeruli
How do you spell?
in the kidney.
What is that called?
The glomeruli is the functional unit of the kidney.
And how do you spell that? I haven't heard that word.
Oh, man.
You're good.
That's
You're
plural.
really good, Dr. Mencia. How do you remember all this? I have no idea.
Glomeruli.
Glomeruli. Interesting.
Yeah. So the glomeruli is the functional unit, and what they do is they take the blood that is coming in and they filter, and you have millions of them in the kidney. So they will filter the blood and make sure that the waste material go through, and it retain the thing that the body wants, like the proteins and the good things that the body still utilizing, won't let that go through. So it's like if you have a filter and you just make coffee with the ground and everything, and you put it through the filter, you want the ground to stay behind and the water with the coffee to fall through. But if there is a hole in that filter, what's going to happen?
Oh, boy.
Then the
Grounds in the coffee.
The grounds in the coffee. Right? So
love the way you do this.
when that filter has hole that had been produced because of different damages to the kidney, when that happens, then you get good stuff going into the urine that we don't want to get rid of. And then that brings a unbalance in the person's body. And that's why, you get people that will get sick and will get other damage, because once you start losing certain protein, then it can affect your liver, it can affect your heart, it can affect your brain. The person won't be able to think properly because of the imbalance. They feel very fatigued or forgetful, or what we call pseudo-depressed. They are not really depressed. They are just drained out. The kidney, they don't stop working. It's not like a dog that run, and then when it get tired, sit down. The kidney is the dog that don't stop. It just keep running.
Well, I'm going to ask you a few questions. I want to tell everybody about you, though. Now, can you imagine going to a physician like this, someone who knows so much, and he still is a family practitioner? I mean, he is a geriatrician, but he takes you and he looks at you and he can tell so quickly. He has a great staff, and he founded something. It was his dream. He will tell you about this.
Diagnostician.
A diagnostician. That's what you are, very much so. And he founded this wonderful organization called AGI Medical and Dental Centers. They are located in Fort Lauderdale. They're also located in Boynton Beach. And it's really a wonderful place to go. It's friendly. It's so you come out feeling so good. I see a lot of the patients going in there. The phone number is 954-489-1345. 954-489-1345. But then they have a wonderful new center in Boynton Beach. It's not so new anymore, but it's really very, very, very good. It's over there on Hagen Ranch Road, and if you want to go there, Dr. Mencia does take patients there on certain scheduled times, but he's primarily in Fort Lauderdale. And let me tell you that they do something that's very special. They're open on Saturdays. You imagine all the days he works. He's open on Saturdays because he's always said there are a lot of people that they have to work, they can't get to me. And home visits services are available for homebound patients. Go to their website, agifl.com. Call them at the Fort Lauderdale office if you want to see him. It's such a privilege, frankly. It's a privilege to have Dr. Mencia as your physician, as I do. I mean, I have such confidence in what he is and who he is, and you can just hear him on the radio and how he just, any subject you want to ask medically or emotionally, he'll tell you. 954-489-1345. Okay, let's continue to take this, because I think it's very, very important that we help people with this whole problem with the kidneys, and the bladder. I guess I always think of the bladder first before the kidneys. Isn't that strange?
Yes.
Because I guess the bladder is the funnel, as you said, but the
it's
kidney
the funnel, is
really the factory. I got this now. I got the factory, and it's really terrific. Now, what can we do to keep both these organs healthy? What should we be doing?
The main thing is that because it's it's a route, it's a highway. So just like we take care of our streets and our roads, we need to take care of this route so that it's functional. It's always functional. So when a person start dehydrating themselves, they don't want to drink fluid for whatever reason. The amount of filtration the kidney is doing will sort of slow down. So dehydration will take, from the million nephrons that we have, and let's say 60% of those nephrons are working, 40% are non-functional. So dehydration is one of the main reasons we tend to damage our kidneys. So we need to keep ourselves well hydrated. And if the best prevention of kidney damage, the best prevention is keeping our body well balanced chemically and keeping our body well hydrated. Remember, water is the universal fluid that the body uses. More than 80% of your body is composed of water. So water is extremely important to your body. Things that tend to dehydrate you have to be careful with. So if instead of drinking water, you drink coffee and tea and don't compensate that with water, coffee and tea is a diuretic. It makes you urinate more. So it tends to force the kidney, stimulate the kidney to filter more. So if you are not replacing that fluid, you will have a tendency of getting dehydrated, and as a consequence of that, you're going to have a tendency of damaging your kidneys. Certain medication that we take, if you have to take an antibiotic, the strongest is not always the best. So the antibiotic, we have to be cautious to take enough antibiotic to take care of whatever infection we have. But sometimes, and the doctors are more guilty than the patient of this, because the patient will come and say, I have this sinus infection, and they'll give you the standard treatment. And 2 or 3 weeks later, you are back over there looking at the doctor with, giving the look. And you say, why do I have this sinus infection again? Why is it keep coming back? And the doctor gets frustrated and treat it again. And then you get to a point and say, okay, you want to come back with sinus infection? I'm going to double the amount of antibiotics. So instead of giving you 500 milligrams, I'm going to give you 1,000. Instead of giving it to you twice a day, I'm going to give it to you 4 times a day. And when that frustration, the doctor write down that prescription with that frustration, the patient don't know any better. And they're going to go home and they're going to say, the doctor just want to make sure that I don't get the sinus infection. It's not that he see me as a pain in the butt and that I keep coming,
Oh my.
And in my book, the right thing to do is, okay, it's time to call the specialist to see why this person. Let's get to the root of your problem to see why. Is there a problem with your immune system? Is there a mechanical problem in your sinuses? Let's get to the root of that problem. Why are you getting those infections? And what can we do to prevent it? And not for us to get frustrated and blame the patient for being sick.
Amazing.
So a lot of time, we as physician and nurse practitioner, we can overdo it. We can overkill. And it's better to be cautious, especially in the elderly patient. I get students that rotate from me from all the major universities here in South Florida. They come to learn about geriatric medicine at our center. And, they are amazed that sometimes I just tell the patient, put yourself on a clear liquid diet, no antibiotic, and I'm going to fix your problem with your guts. And I say, the patient is having diarrhea, and the patient is throwing up and is nauseated. I say, that's okay. Let the body first. And they know I'm in the office 6 days a week, so I don't have to tell them, don't come back until 6 months. I can see you tomorrow if I have to. But give your body a chance to cleanse itself, to reestablish itself. And sometimes, a person put themselves in a clear liquid diet, and they're taking enough fluid, nothing solid, and the body just needed 6, 8 hours, maybe 24-hour break, and it will reboost itself and will take off by itself.
Well, stay tuned, everyone. We're going to be back right after the 7 o'clock hour and talk more about this. I love this conversation. I think it's many people are listening because no one really hears this from anyone else. So just stay with us. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.